April is IBS Awareness Month, so let's talk about this really common gut condition and what can help manage symptoms. Hi, I'm Laura Tilt and I'm an IBS specialist dietitian. So IBS, or Irritable Bowel Syndrome, is a functional gut condition. This means that the gut looks normal, but the way it moves and functions is altered. More recently, IBS has been renamed a disorder of gut-brain interaction, reflecting the fact that the communication between the gut and the brain in Irritable Bowel Syndrome is dysregulated. Now, symptoms of IBS include abdominal pain and a change in your poo, usually constipation, diarrhoea, or perhaps a mixture of both. It affects around 1 in 7 people in the UK and 1 in 10 globally, but many cases go undiagnosed, which means the real numbers could be much higher. Now, there's no cure for IBS, but there's lots you can do to help manage symptoms, and broadly speaking, these fall into 3 approaches of diet, lifestyle, and medications. First off, diet. Now, certain foods and drinks like caffeine, alcohol, fatty foods, spicy foods, and some types of fibre can trigger IBS symptoms. Adjusting these first can help. And if symptoms don't improve, you can consider a trial of the low FODMAP diet. This is the type of diet which reduces the amount of FODMAPs or fermentable carbohydrates in your diet, which are known to trigger symptoms in people with IBS. And we'll be sharing lots more on this approach over the month. Approach 2 is lifestyle. Now, sleep, stress, and exercise can play a role in IBS management. For example, we know that stress can really impact and aggravate symptoms, so finding ways to manage it can be super helpful. Gentle and moderate exercise, like walking or cycling, has also been shown to be helpful. There are also more advanced approaches like cognitive behavioural therapy and gut-directed hypnotherapy, which we'll share more about in the coming weeks. Finally, number 3, medication. Different medications can target symptoms like constipation, diarrhoea, and abdominal cramps. If you want to explore medication, chat with your GP who can discuss the options with you. We'll be sharing much more about approaches for diet and lifestyle, including the low FODMAP diet, over the coming weeks, so stay tuned, and if you have any questions about IBS or the low FODMAP diet, drop them in the comments below.